guest at the first annual Ericksonian Congress. And the only time they had met, Whitaker picked Erickson up at the airport, and Erickson said to him, "How many kids do you have?" And Whitaker said 6. And Erickson said, "I got 8. And they never spoke again. But, so one might wonder what Whitaker was doing as a guest at the Erickson conference. But I finally figured that out. It took several years. And in terms of, Erickson used to say what the difficulty was when two people came into a room with each other is who wanted what from whom, which is the dilemma you're going to face when people come into your office for hypnosis. See, I think on the one hand, we're demonstrating hypnotic inductions and techniques. On the other hand, when you get a physician referral for hypnosis, you might get it for ulcerative colitis, or very difficult situations. Anything can come your way. So then the question is how you assess the situation in the first couple of minutes. Because if you don't assess it correctly on who wants what from whom, you might be doing the wrong job. See, for example, when Dr. Hedenberg worked with the first patient, he was showing Dr. Hedenberg how it was to be him in terms of the fear of abandonment, the separation anxiety, and Dr. Hedenberg sensitively picked up what the job was and went with it from there. The second person talked about, see, there's also an interpersonal aspect and a primitive aspect. So the second person said, well, I kind of took a look at you so far, Dr. Hedenberg, and you look like someone I can get deeper with than I've ever gone before, even though this is an audience situation. So she defined again what the job was, and then Dr. Hedenberg went from there. Milton Erickson and Carl Whitaker had one thing in common many things in common, but one in particular, an ability to assess primitive phenomena instantaneously. When I first went to Erickson used to tell stories 4.5 hours at a time. And my conscious mind was working most of the time, and my unconscious mind not so much, if at all. And over the course of these stories, in an extended period of time, the conscious mind would continually loosen up. So you would get a sense of these primitive kinds of issues, and you would get a sense of how to use it. But the problem here, I trained with Erickson for 3 years, so the problem is how to do it in a short period of time. Give you an idea at a somewhat conscious and somewhat unconscious level of what the kind of things one needs to notice are as soon as a person comes into your office in terms of getting the job straight that you're going to do. And I think the mock family therapy session with the Whitaker style work, which I'm going to demonstrate, will give you the quickest crash course to the unconscious. Then tomorrow, when my title is Hypnosis and Countertransference, what I would like to do is extend this work using the metaphor itself, where people start to talk from the audience, and I begin to both assess the job on the spot and tell the story from the unconscious. So you'll see how it's done in a way where you get through your own, as best we can in a short time, countertransference block in yourself in a way that you can then flow with that patient. So that's my objective, a continuity between these two pieces of work here. What I'd like this group to do is take about 2 minutes I'm going to walk out in the hall, and I'll come back, and in that 2 minutes, work up some kind of a family scenario that I'm going to have to deal with when I come back in. It's the second session, because the first one's more of an administrative session. So we're into the work in the second session. Nothing too elaborate, just quick. Roll on.
I'm the mom. My name is Berta.
Can't hear.
I'm mom. My name is Berta.
I'm Joe. Boy.
I'm Jane. I'm the 11-year-old daughter. Very good.
And I'm Hugh, and I'm the father.
Do we need to also explain the scenario, or you?
No, you just need to act it out.
Gotcha.
You're going to be trouble, I can tell. One of the things you might notice is when I do things that seem crazy, absurd, the reverse of what it looks like. Erickson and Whitaker both had a way to do a kind of jujitsu in their session, so you might just pay attention to that. Okay, here we are. What brings us here today?
Well, the wife and I went out to Desert Hot Springs for the weekend and left our son at home for the first time by himself, and came home, and I had checked the mileage of the car just to be safe. When I left, I came back and discovered that the car had been driven for 4.5 miles. So he obviously took the family car while we were gone, without our permission and without a license. Went for a drive, and we're trying to work out and figure out what to do.
Right on your left.
I want you to sit in old lap of mine.
Hey, why not?
What for? You got your own chair here.
You're making me nervous.
Well, I don't want to be here in the first place.
Well,
They dragged me over
I
here.
don't want to be here either.
Well, so what are you doing here? Leave.
Well, I can't because it's paying me for the hour.
Well, if he's paying you, I don't care.
Well, I don't mind. I just want to sit on his lap.
I don't want you to sit in an old lap of mine. You got your own chair, boy.
Boy. You know what this is?
The light. This is not the light.
I don't.
Lights,
I prefer people who aren't polite. That's all right. It's called joining.
I got my own joint.
Put my mic up. Is this working now? It's not
Go
working.
home already.
Well, yeah, I gotta sit it out 45 minutes too. Oh, I see.
We're paying $150 this time, and hopefully we're going to get somewhere.
What do you want to get?
Want to figure out how to resolve this so that he'll stop doing this kind of things and we can trust him.
Boy, good luck. In an hour?
Well, we can make a start on it.
You know, we tried everything. We really exhausted everything we could do.
How can he stand you two, anyways? He looks like he's going crazy.
Betcha.
Can you stand him?
Absolutely not.
I didn't think
That's
so.
crazy. They don't let me do nothing.
You ever think of getting even with him?
Betcha.
How are you going to do it?
I already did some.
That probably ain't enough, though.
Not enough.
Driving without a license and doing things like
Doesn't
that.
happen.
What's
Put the
next?
car back.
What's next?
I'll think about it.
Well, you could send her to a hospital.
What do you mean?
Well, she doesn't fit in the family. I mean, he's such a pain in the ass. What are you going to do with,
She's no problem at all.
I know, that's the problem. He's got all the attention.
Pretty girl.
She's goody-goody. He's going to drive you all crazy if I can help him think of more things to do. And you're just kind of stuck. I suppose every family needs a human sacrifice. It looks like you're going to be it. How old are you now?
I'm 11. I'm 11.
Have you thought about running away from home yet?
No. No.
The idea seems to delight you.
Oh, I don't want to run away from home. Shut up.
You said you think it'd be better that way?
He's a creep.
Yeah, keep it dark.
Well, you think you two hate each other enough?
I don't hate him.
So it's not enough then?
What do you mean?
Well, you said he's a creep, and he said something about you, and, you know, I saw hatred brewing there. I got kind of interested.
He gets everything.
If she's much younger, you are
Much younger.
older.
Just 3 or 4 years, much younger, so what?
So, if you two hated each other enough, see, the problem seems to be with your kids is they don't hate each other enough. Because if they hated each other enough, it would help the family orgasm.
What the hell are you talking about? Orgasm, schmorgasm.
I thought you wanted to go.
Yeah, I want to go.
You seem more interested now.
Interested about what?
I don't know. I said orgasm, and all of a sudden you're asking me questions.
I don't know what the hell you're talking about.
You don't know, how old are you?
15?
And you don't know what an orgasm is?
I don't know what the hell you're talking about now.
You masturbate?
What does this have to do with anything?
Well, you said you didn't know what an orgasm was at 15 years old. I wonder where you go to school. You're hanging around with the wrong kids.
Go in high school.
He takes the family car, and now we're talking about sex. What's going on?
Well, the family, as I experience it here, seems to be kind of dead. So the question is, the only heat I saw was between the daughter and the son, depending on how much they were going to hate each other. But apparently it wasn't enough to help the sex life, the sexual life of the family between you two.
I feel very uncomfortable, discussing such topics in front of the children.
But if they don't help you two out, how's the family going to be helped?
We get along fine. We haven't got any big problems. The problem we came...
That's not what I see. I see you got a hell of a problem in terms of this family would just damper the life out of anybody until this guy goes crazy and wants to get even and kill all yous. And the only chance you got at kind of resolving the issue is if she came into the family and got out of this catatonic state. But it doesn't look too hopeful because they don't hate each other enough.
You think it's a joyride, but you see what happens now. The whole family is kind of under attack.
Oh, well, I'm not doing nothing. You drag me over here and now you tell me I'm tappish, my tap. I don't know. What's he talking about?
He's kind of like me when I grew up.
What is he talking about?
You know, what's he
He's trying
talking
to
about?
say something very important, and we have to understand what it is.
Okay.
Well, it's okay if you don't understand what it is, too. Sometimes, I just say things and they invade the unconscious, and then 6 months later things happen. Or 3 months, or even a week, or 2 weeks, or a month. It's hard to know when. It might even be tomorrow.
We thought we had a normal family, trying to do the best for the children.
That reminds me of a story. There was a family therapist in San Diego. I forget his name, but he wrote an article one time. And he says, I'm going to try and be as truthful as I can. And he wrote the article about his own family. And he said, but no family he had ever seen was normal. And being as truthful as he could, he knew he couldn't present the exact nature of how difficult it was on a primitive level in his own family. And this guy's like a world-famous family therapist, and he was talking about as truthful as he could write. He couldn't write it as awful as it was. He said, when you tell me you got a normal family, It's like, I don't know, I've never seen one. Except for you seem too normal. What do you make of all this? Maybe you can tell us what you've been thinking about.
Well, my brother just gets in lots of trouble. He always wants to do what Daddy tells him not to do. Like he just wants to see what Daddy will do or something. See if Mom will get all upset.
I just do what I want to do, that's all.
You know, your problem seems to be that if you and your brother have a contest, he votes for him and you vote for him, and then the score is 2-0. Does anybody ever vote for you in the family?
He gets all the attention.
See, you voted for him, now it's 3-0.
Well, how do you mean that he gets all the attention?
Well, that's 4.
We give you
That's
enough
4.
attention. I mean, he is an adult.
She's saying, don't ask again.
Many boys are like that.
That's
He's
5.
not a bad boy.
That's 5 for her and 0 for her.
Baseball score, or what is it?
Can you be more of a pain in the ass than he is? I mean, it's your only chance in this family. Erickson would utilize in the hypnotherapy any one of these suggestions. He might utilize it to get her to do something more outrageous than him. In an ordeal, perhaps, or kind of a hypnotherapy situation. But
I wanted to get a horse, and they didn't even listen to me. They said no. Everything is about him.
Have you ever thought of getting a horse and driving it right through the living room? While they're all paying attention to him, and you just drive it through with a sword in your arm?
You mean like Pippi Longstocking?
Yeah.
Not really.
I bet that's one you won't forget.
Well, I don't know. She's a very good kid, and when I was young, I was also very quiet and very calm. I don't see anything wrong with that. I mean, the way you are talking, it's as if, you know, she should be even worse than him.
I think it's the only chance for the family to survive. Otherwise, I mean, I don't see any sexual heat going on in the family.
Well, you know, life is not easy when you have 2 children and all that. So, and sex is not the #1 priority, but again, talking about it with children.
You're going to give Freud a bad name, you know.
Do we have to come to a shrink?
I don't know what's
Is
going
it?
on. I'm feeling confused. We came here to talk about the situation with the family and with you, and now we're talking about sex, and we're hearing stories, and we're having comments. I don't understand. This is not therapy. This is not counseling.
Exactly. But, you know, Erickson used to say, into every person's life comes a little confusion and a little enlightenment.
So I'm confused, but enlightened, I don't know.
You're a slow learner, but there's hope.
It could work.
Thank you.
There are some issues, you know, in our marriage.
Mm-hmm.
And not always that easy. But
Can you talk
as
about...
parents,
Can you talk about in what way it's hard for you in your marriage?
Well, it's hard because, you know, my husband, he only knows one way. I mean, everything has to be his way, and when he wants it. I feel sometimes that he tells me things to do the way he tells Joe.
So you feel pushed around? Or?
Yes. And I resent it. But then I know that we are parents and we have to give the children an example, and we try to solve our parents so that the children don't know that. I hope.
So you're saying you got these difficulties in the marriage, but you're both doing your best to educate the kids as best you can.
Yes.
Yes. I think that's true. Have you ever thought about being more pushy?
Well, you know, you have a pushy person, and if you push him, then the sparks and flame comes. So somebody has to be calm or...
So yeah, but then what do you got against the flames coming up?
I think that, you know, if he is pushy, I try to kind of smooth things down so that then he's not so hard on Joe. Joe is at a difficult age.
See, but you described the problem as being pushed around. So if you look at the opposite of that, the way to turn that around would be if you could be a little more pushy. Can you think of something maybe you may want to tell us, maybe you don't want to tell us, but outrageous that you might do in this family?
Me?
Yeah.
Just leave them and go somewhere for 3 days just to get away and enjoy myself.
Yeah. You ought to go
Yeah.
now.
Okay. I mean, after all that job and work I put into keeping the family going, I think I deserve some rest and, you know, time for relaxation without worries. What he will do and what he will say, it's difficult.
Uh-huh. Would you go by yourself? Or would you go with your husband?
Yeah. I don't know if I go with my husband, with my...
Mom, you take me, right?
No, don't talk yet. I'll come back in a minute. Would you go with your husband? What were you saying?
I'm not sure. Well, to be frank, I would like to go myself without you.
Oh, that's pretty rough. I mean, I think it's good you're asserting yourself. And I think he felt kind of hurt. But maybe what you could do is take one by yourself, and then you and he could take one and not tell the kids when you're going. Just disappear.
You would take me, right?
She's married to him.
But we are used to take children with us when we go. This was the first time we went away, and we took, you know, Jane with us. He was left alone. And what happened?
He's a big boy now.
Big, we leave him alone for the first time, and once he do, he takes the car.
Well, it's 'cause you guys are driving him crazy. He wants to get even with you.
I don't understand that.
I know.
I don't understand what's happening. We come here,
Well,
now we're talking about me, and we're talking about our relationship. I don't understand.
it's a bummer. You might need more sessions. I was hoping to have the time off.
I'm not sure I'm going to finish this one.
Well, maybe there's some hope for you yet.
You talk funny.
I know. I am. You don't have to think it's helpful, you know, for me to help you. You don't have to understand it. See, what I'm doing is I'm talking to your unconscious minds, and I'm totally bypassing your conscious minds, or whatever resistance you have. So, I'm telling this for the audience's sake, too. See, I like that. Every once in a while I can use a hand. You might become my co-therapist. So, you see, you don't have to understand what I'm saying at the conscious level. It's not necessary at all. But what I'm saying is going to cook in this family a long time after this session. And things are going to begin to happen. Now, you're not going to know what they are at the conscious level, and there's no way you can control it. So this control in the family is going to begin to disappear, and people are going to become freer, and you're not even going to know how it happened. Because if I told you how, and you understood it all right, the whole family would just massacre it and go back to where you were, which is why you came here in the first place. Again, utilizing the resistance.
Could we talk about that a minute? Step out of this.
Shoot.
Because I was aware, probably because I work in the field like everyone else, of the seeds that you planted. And so I could identify some seeds and I could feel them germinate in this family. At the same time, I'm not sure you're not saying that there's something below that you've also set in motion.
What do you think that is?
There's something below that?
Yes.
Well, if I knew what it was, then
I see it
would
very
put it in the
clearly.
first
In effect,
category.
I'll try to act into that role. There's a very, very involved family dynamics here with almost allegiances here. And in fact, I was trying to act into the allegiance here, noting, at least in my level of consciousness, perhaps even subconscious level, about the dynamics between you two. And I was, and almost like acting on behalf of her against your domineering and ungiving kind of a way of dealing with the family dynamics.
Okay, I'm going to bring it back to here, back in the group, because I just lost control of the situation. Families are tricky.
You betcha. And I hope I didn't, I was really acting a role that I've had numerous situations like that, with a rambunctious 15-year-old coming in.
One of the things, I'm going to use the audience as a co-therapist now. I use whoever I can. See, but one of the things, at least my experience with Erickson, while he's known as a very indirect person who uses metaphor and indirect suggestion, he was very clear about not getting knocked off the therapist's seat, maintaining a certain kind of, for use of a better word, authoritative. He knew how to use his authority, whether it be direct or indirect, in a way that made it clear he was the doctor, and there was a hierarchy of generations. You weren't buddies. I wrote him a letter one time, Dear Milton. He wrote back, Dear Dr. Bergantino, signed it Milton H. Erickson, MD, all the way through the work. At the end, he wrote, Dear Len, when the work was over, signed it Milton. So, I mean, here it is. We have this chaos here, pre-psychological chaos at a primitive level that nobody wants to deal with. Now, when Erickson did hypnosis, he knew that people hated this kind of chaos for the same reasons Dad and Mom started to complain about it. But he also knew that if he set up a situation where the chaos started to take place, in order to resolve the chaos, the family would come up with a new solution by itself, or the patient would come up with a new solution by himself, just to close the chaotic gap that they couldn't stand.
give him any kind of directions, kind of steer him in any direction to possible problem solution as a therapist?
Not in your case. Yes, Nancy.
This is a question or an observation. I think we've all gotten, let's see, your interventions were very specifically and artistically aimed. We've all been in situations with families in which, at one point or another, we've been reduced to behaving the way you behaved, okay? It's your style. I have appreciated that. But I don't do it because it gets me in trouble. Now, perhaps it's because I don't know how to handle it. Perhaps it's because over the years I have developed other techniques. But it always got me in trouble. It is it's a wild, and it's an interesting style, but it's an aggressive style that invites attack back. And I simply note that and wonder how you handle the aggression that it inevitably invites back, since I never could, so I switched styles.
One of the things, can you give me an example of the kind of aggression, be that aggressive patient with you and I'll be the therapist?
You're going to be the therapist.
And you be the person coming at me with the aggression.
Let's come back to what happened here. Your first, I think the opening shot that when we recognized that you had this kind of style was when you said, you guys are paying me $150 for this session.
He said that.
Yeah.
Whatever. You said.
I would have raised his rates at that point.
All right.
But
so now, you would like me to be the patient to
He
your
just did it.
therapist?
He just did it right there.
Okay.
Like his style just came out right there. When he came back, I would have raised his rate at that point. He was just kind of,
so
yeah.
okay, the question is, what do you have against trouble? You see, you say you always get in trouble. The way I look at it, I enjoy the trouble. I'm kind of like him, see. So I joined him. I said, yeah, he's kind of like me when I grew up. Or so I can use myself that way. But you might take an approach utilizing yourself, say, Jesus, boy, I'm going to get in trouble in this family. This is the kind of family that's big trouble. I don't even know if I ought to be here. What a mess this is going to be. And then one of the things one therapist did is he was trained by Mnuchin, and he says, in fact, I'm in so much trouble, I'm going to call up my supervisor, Sal Mnuchin. And he picked up the phone and he started to dial, and he says, Sal, he says, boy, I'm in big trouble in this situation. This family has me perplexed. I don't know what the hell to do with it. And there was nobody on the phone, by the way. And what do you mean get rid of them, Sal? Throw them out? So the family was afraid of a bit. Sal, it's only their third session. They're hopeless? Did you ever fight with your wife this morning, Sal? You get up on the wrong side of the bed, get rid of them. Or don't bother me anymore, I see. Okay, I'll do the best I can with it. Thanks a lot, Sal. And then he's out of they can't strangulate that one therapist anymore. See, the problem is, if you're with a family, you really need a co-therapy team, because almost any family is strong enough to suck you under and murder you. So, if you don't work in a co-therapy team, you got to figure out how to break the bind. Like I started to use the audience when I felt trapped. Use whatever you can get, or whatever you got going for you or against you. Just go with it.
But don't you think there's been an undermining of your authority when you got on the phone and said, geez, this family is,
You see, but you're describing a dynamic of undermined authority. So in that case, the issue is how to go one down. How to go one down to maintain your control. And then if they say to you, geez, you're one down, what kind of a therapist are you? And you say, I'm an intelligent one. I realize that any family with 2,000 years of history is strong enough to beat any therapist. I mean, you're lucky you popped up here. Imagine if somebody tried to cure you guys. Any other comments on the kind of issues I mentioned in terms of utilization, resistance? They all fit into the hypnotic procedure. For example, each one of these kind of phenomena I've demonstrated could have fit at some point into the work you saw Dr. Hedenberg do. It depending on what that patient did at any particular time. It's just at a different pace in a more soothing way.
Say more about that. I don't quite understand.
Yeah, in other words, here you're getting a very fast, primitive unconscious that in a hypnotic session would happen much slower, much more subtly, but you would still need to pick it up and be able to frame the work in terms of understanding this phenomena in order to get the primitive job done that that patient requested you to do. It would come in the form of an embedded command, such as the embedded command with Dr. Hedenberg's work was, I want you to provide me an opportunity where I can go deeper. So that's one example of it. But when you get into many people who come to hypnosis have failed at a lot of other kinds of therapies. So the kinds of problems they have, ways of making the therapist impotent. The therapist is really an impotence in themselves. Only the way it comes at the therapist, or for example, I was starting to tell you one person who came to me asked me to, he said he had he'd seen 5 different physicians, and none of them could find the particular problem with which he was having these psychosomatic aches and pains. And would I hypnotize him so that he could develop a kind of state of relaxation? I think that's how I understood him, by which he could continue to soothe his psychophysiology, immune system, whatever, to rid himself of these pains. So I did what he asked, and at the end of the session, he comes out of the trance and he says, boy, that was relaxing. He said, just like I always do myself. And he grinned. So I knew I'd been had. So the second session he came back, I said, geez, you know, I don't know why you're here, because it looks like maybe you're cured. You know, you might have been cured before the first session, because it already sounds like you're a master hypnotist. I mean, I've studied it for years, and I have no reason to doubt your word. I mean, you say you do it 10, 8, 7 hours a day, and so I don't really know what you want from me. I mean, it seems like you can already do it. And he says, well, I got all these pains. He says, so I want to deal with the psychological aspects of the hypnosis too. And so I said, well, seeing you're already a master hypnotist, why don't I just deal with the psychological aspects, because that's the only part you got trouble with, from what you say. Do I understand you correctly? Because at any moment he could, any moment this guy would slit my throat metaphorically in the session. So at that point, given the fact he was showing me how it was to be impotent, what I needed to do, if I was analyzing him, I would make that sort of interpretation. But in a short-term hypnosis, what I needed to do was create a situation in which the impotence, which was his own, he would be forced to deal with. So I asked him a few questions, and I says, well, obviously, the problem here is you describe a relationship with your dad where you kind of treat him as a shoeshine boy down in 30 miles from where you live, and it sounds like you're married to your mother and you'll never get out of that one. So basically, I hear these pains are getting worse and worse, and the physicians, of course, would be able to detect it. I think you're quite right, 20, 30 years from now, when your organic illness is far beyond what they'll be able to cure. So I stepped up his anxiety and his impotence. So all of a sudden, he's on the spot, not me. If we're playing pin the tail on the donkey, it's better on him than me. So I said, you know, I don't see any point in seeing you again this way. At the same time, I heard a request, him saying, look, I need some support. I need some kind of connection with a male, because my dad got cut out when I was like 8 or 10, and things have been a disaster since then, although I've superficially made it in my mind, so he's nothing, because I'm married to my mother. And of course, my brothers and sisters I don't talk to anyways. I'm disconnected. So I said I'd be willing to see them all as a family, and told them how to get that together. And I didn't hear from him in a week and a half. And the second thought about what he wanted, that male connectedness, I called him up and I said, geez, I hadn't heard from you. I was wondering how you were going. And he real passive-aggressive, well, I'm giving it a lot of thought, you know, like, screw you. And I says, well, maybe you ought to come in and we'll talk about it. And maybe you need some support in how to do this. In a very soft kind of way. And now, see, I can give him the supportive relationship he asked for, but at the same time, anytime he tries to nail me, I'm going to talk about how impotent he is that he can't bring his family in. So I won't be one of the people on his notch of dead physicians and therapists. So the question is how to set the frame up so it's not your scalp, because if they get your scalp, the ball game's over. That's what I think the crux of the matter is on who's practicing hypnosis and who isn't. For one reason or another, those doing it know how to get through that. I have 2 minutes left. Yes. Oh, it sounds like you might be the first.
I appreciate your style, and I also agree.
No, the problem is I can do most anything and get away with it because I can take the next step. So again, the problem for you is how to get the oatmeal, and I don't mean this personally, but I mean certainly I had to learn it. As long as I have access to the unconscious as it goes through like this, which again I learned from Whitaker and Erickson over years, but the faster you get at that, the next step will be obvious to you. And if it isn't obvious, I stop in the middle and I do what I call automatic writing. Erickson used to have a way to just cut out about 12 feet of space in which no craziness got into it. It was like a rectangular glass wall. And he'd go into this unconscious state, and it was like a pure laser beam. So the closer you can come to that, you'll know what the next step is. It'll come to you, and your own anxiety won't get in your way. And when it comes, you can increase the level of outrageousness you can get away with. So take it a baby step at a time. Thank you. Oh, one more thing. My own particular style, the reviews of it are there, and also workshops I'm doing in Australia, if anybody's interested. Thanks again.
This is my first formal exposure to hypnosis, and what you just said at the end of that particular session made it sound almost like a contest of wills. There was a battle going on here, and the upper hand. And
It's not always the case, but when it is the case, you got to know what to do with it. A lot of times people come in and they're genuinely cooperative, and you don't need to do that. But when you need it, the better you are at knowing what to do with it. I mean, if you read Milton Erickson's book on common therapy, you'll see that patients threw everything but the kitchen sink at him. And his solutions were often incredible. I mean, there was one girl who said her feet were too big. Her mother called up and says, "My daughter says her feet are too big." And she's cut off all her relationships with the school, with the teachers, with her friends. In fact, she won't even leave the house to come to your office. And this was a time between his first bout of polio and the second bout where he could walk, I think with a cane at the time. But he says, "Why don't I come to the house under the pretense of giving you a physical examination and see what the situation is?" So he'd use whatever was given him. She won't come out, he'll go there. So mother's on the bed, and she's got a fever, and he said to the daughter, "Well, why don't you go out and get me a wet towel for mother's head?" And she comes back in, and as she comes back in, he places himself in a way where he pushes his heel down rather harshly into her toes in one swift movement, sort of like a Zen master would. And he turned around and says, "If you grow those damn things big enough, a physician like me wouldn't be in such an awkward situation." Well, the only thing the mother knew and the daughter knew was that this physician who came to the house was fairly rude. So Erickson was not hung up on people liking him. He often used their reactions in any way they went off as a... Is Ira here yet?
No, it appears he's not coming. How about letting John and Gil do their medium over now that they were going to do tomorrow at this time? And then Ira can do it tomorrow.
Sounds good. We're going to have a shift in the schedule. Let me just finish this one story, and Dr. Hedenberg and Dr. Steingart are going to do the part of the program they were going to do tomorrow, today. And we hope Dr. Greenberg will be able to do his presentation tomorrow. So the only thing that the mother and daughter knew was this physician who came to the house was fairly rude, but she called up in a week and a half and she says, "Unexplainably, my daughter has resumed all her natural activities with her friends, the school, the church, etc., etc." So John, Gil, please come up.
all the responses. All the responses used in various ways.
Move through their impasses so they can help patients do the same. Well, the question is how to do that with this audience. How I usually do hypnosis is similar to what Dr. Gilligan described yesterday, where Erickson told stories hour after hour. And these stories were based on minimal cues of one sort or another, from the unconscious of the therapist to the unconscious of the patient. So the thought I had, which was partly evoked by Dr. Gilligan's work yesterday, Margaret Mead told Milton Erickson that the pace at which he spoke, she had only heard in a rare African tribe relatively free of dis-ease. Now, I brought my purple pen, my pad. I customarily begin a session doing 5 minutes worth of automatic writing, from which point the stories pop out and go for the 50-minute hour, which usually with a series of stories, an existential shift occurs in the functional stuck point of where the patient is. I could do that here, but I'm not sure it would help people beginning to learn the skill how to do it or how to move through it. So I have another idea. I would like each person to start off by saying maybe a paragraph. I had a difficult case, and the problem I had was, at which point I want to see what stories come to my unconscious mind. If nothing comes, I may do automatic writing for a moment. Or I may go on to someone else. If something comes, I may tell, at least this is the hypothesis. I've never done it this way before. I may tell 1, 2, or 3 stories, which my intuitive hunch is will be the countertransferential stuck point with which I would hope these stories, whether it be today, tomorrow, next week, next month, or even the week after, would give you the beginning of a substantive base with which to move through your own countertransference stuck points. I'll be doing it in metaphorical style, which Erickson thought of, I don't know what words he used, but it's bypassing the resistance, using indirect metaphor as a way to, well, just bypass whatever blocks people may have about things. Now, when you talk to me, I'm going to ask you to do something different. It's going to feel like you're sitting on yourself. Dr. Gilligan spoke of a mind-body connection. The way that takes place is that this pace Margaret Mead told Dr. Erickson about. So what I would like is when you tell me the story, in one paragraph, I had a difficult time with this patient. You tell it to me by practicing this pace as close as you can get to it. Gilligan's focus was on the mutual relationship aspect of the pacing. This focus is different in that it's a particular cadence that Margaret Mead told Erickson she had only heard in a rare African tribe that was relatively free of dis-ease. So the question is, if this pace becomes integrated in the sense memories of each of you, like a musician has a metronome, you then control the whole pace by which to create the disease-free environment as close as you can, which creates a resting from what at its worst would be neurasthenic exhaustion in people, or running down of the immune system. I would like whoever wishes to begin. Yes. Yes. You can stay there. Just say it right from your seat. Nice and loud, but in this particular pace. Extremely what?
Very needy and demanding of both of us, and that was my difficulty. At one point, I felt giving more attention to the husband and being somewhat annoyed by the wife. I felt that unless I work it through and give her what she needed, she would not be able to move from this place, and that relationship will not change the way they assumedly wanted.
Thank you. I had a psychologist friend who lived in San Diego. He and his wife came to see Dr. Erickson. There was a group of us there that day. When he walked in, he said, "My wife has severe problems. I want you to talk to her, period." Which was an unusual proposal for couples counseling. The man sat with his back to the door, one step away from leaving. Erickson followed the command precisely. He told stories to the wife. She was from a different culture, and she used to look down. The only direct intervention he made was he said, "Look up at me." Interestingly enough, the man heard all the stories. Now Erickson knew who he could work with and who he couldn't work with. He could size up right away in very few minutes the projected outcome of the work. Now there was one such woman in the group, like the one you described. And Erickson, when she said she wanted to lose weight, he looked at her and he said, "Of course you know I've already worked with you about that." My awareness is that he had been telling stories in the group that seemed to be working with other people. The woman's comment was, "I know. All my feelings inside are different." Erickson has very little ego investment in terms of his willingness to be a disappointment, his willingness to fail, his willingness to utilize his failures as a way to enhance success. He had no investment in going in any particular direction. He talked about Occam's razor. The most expedient way. like another person to bring up a comment. Yes.
I saw a patient.
I'd like you to make your cadence a little bit softer. It sounds like I saw a patient. Make it I saw a patient.
I saw a patient
A little bit slower.
this morning.
This morning.
Who is very, very sarcastic. I find that I dread seeing her. I would actually rather that the person be physically abusive than be sarcastic in their speech.
What sort of comments does that person make to you?
She refers to me as a brainless snake. An example this morning, I asked her if she would take medication that I prescribed. She said, I think you know I would not take medicine given to me by a brainless snake.
That reminds me of a story. There were a couple of people from Canada in Erickson's workshop. And when Erickson worked, it was like a symphony, an unconscious symphony, just an unimpeded flow, which of course I took great delight in. Now, these two people from Canada had very jerky motions, and they kept bringing them back to the conscious level. And I knew I was an egghead at the time. I didn't need any more of that. I began to become furious. Well, Erickson looked at me and he says, I remember when Mrs. Erickson and myself went to a concert of Yehudi Menowin. He says there were two men sitting about 10 or 12 rows behind us, making the worst awful noise, talking, snickering, laughing. People were turning around, giving them the dirtiest looks you could imagine. He said, I turned around and I smiled. I'd prefer to see a good cat fight any day than hear old Yehudi, whatever the hell his name was. I'd like someone else to bring up yes.
I have a very difficult narcissistic patient, a woman about 40 years old, who was extremely wealthy until the record business began to fail for her husband.
Can you hold on for a second? I'm sorry. I thought of a second story I want to tell you. It just left. Oh well, I'll come back. Start again.
This lady, at the very beginning,
It could go either way.
this lady
Maybe I'll intersperse the stories.
is incredibly needy.
Or maybe it's the same story. Erickson used to say, I like to see people for a while, and then I like to get rid of them. And then I like them to refer me new patients. Now, Carl Whitaker, who for some strange reason also wound up at the Erickson conference, said the problem after the first session was how to get rid of the patient. Both of these guys lived to a ripe old age. You look delightful and energetic now. Rachel.
I have a new client, and Celia, 33 years old. Seen him twice. I felt warmly towards him.
Make the cadence a little more mellowed out. A little more mellowed out. A little more mellowed out. The cadence, Rachel.
I like this young man. I offered a lot of my heart in speaking with him. The other day, when it was time for his session, I received a phone call from him saying that he had important lawyer work to do, and would I give him grace in not charging him for missing his appointment. And he, in addition to his important work that was taking him away from our session, he had not eaten lunch, so he was also very hungry. Even though he was almost next door to my office, there was still time for him to be there. He had these other things to attend to, and would I please not charge him or call me sometime to rearrange a session?
It reminds me of a story. Erickson had one daughter who got married in Australia. And she married a Catholic man. And when Erickson went to Australia for the wedding, he introduced himself to the priest who was going to marry them by saying, "I'm the father." But the question here is, you don't look like a priest. You don't dress like a priest. So I cannot understand under what conditions you could offer grace. It seems to be a priestly function. Someone else? Nancy, it must be your turn. No, this isn't your work. This is Nick. This is...
This circumstance that Rachel was just telling us about.
Make the cadence softer and longer. Softer and longer.
I am impressed that the patient calls up, tells you that he can't come for his session, that is his healing. He tells you that he started his moments away from your office, and purportedly he's asking you about money. In actuality, he is asking you if you can let him off the hook for doing the therapy.
Now, how would you put yourself on the hook? What kind of a difficult case do you have?
I do well with all my cases at a much faster pace. I have trouble running at this pace. I don't have any problems, I really don't. Honest to God.
You're the first person I've ever met without problems.
Let's say, well,
Do you have any open time? But you know, the great British psychoanalyst, Wilfred Bion, used to talk about the abandonment of memory and desire. Now, when Bion used to work, people often described his thoughts as coming in from nowhere, from the middle of nowhere, or described his thoughts as having a magical quality, that they just used to occur. Now, I suppose the question you present is what frame of mind would be necessary to attain for those kind of thoughts to occur. Someone else? Yes.
I have a patient who frustrates me. He is charming.
Speak up.
He is charming, accomplished, pleasant.
In your case, I want you to put some punch in the story.
I usually speak with lots of punch.
I'll bet you could frustrate me either way.
He is very negative. He is very pleasant, but unmovably negative. Everything, including his fiancée, he intellectually.
Do you have any torturous fantasies about him?
Actually, no, because he is so pleasant. And he probably arouses not only frustration, but an intense desire to help to see him over his negativity.
It reminds me of a couple of stories. One is Erickson had a patient who the first time he came in, he walked in pacing back and forth in a very agitated, tortured manner. And he said, well, I'll bet you can't work with me either. All the other therapists I've been to couldn't work with me because I can't sit down. Erickson said, oh no, that's perfectly fine. But would you walk in a rectangle? And the man was walking in a rectangle, pacing along. And a little bit later, Erickson said, as you decide whether you'd rather go into trance on the chair on the left or the chair on the right, it'll be interesting to see which your unconscious mind chooses. Now, there was another man in the back of an audience one time. I understand it was an audience of about 300. And Erickson was doing demonstrations. And the man said, Erickson, you're a fraud. Hypnosis doesn't work. Erickson said, you don't have the guts to say that while you're walking up here telling it to me. The man walked forward saying, you're a fraud, Erickson. Hypnosis doesn't work. You can't hypnotize me. Erickson yelled back at him, you're a coward. You're too cowardly to come up here and sit into this chair as you go into a trance. Now, Carl Whitaker is the sort that would talk about how much he enjoyed his fantasies of putting a leather tourniquet around the person's neck and seen it dry in the hot sun. Next. One of the things is at the end of the session, many times people come out of trance. It's quite obvious to you that they were in trance. And they say, I wasn't in a trance. So you could have done 47, 48 minutes of good work. And in the last two, lose your scalp. So how do you deal with that? Erickson used to take whatever phenomena was occurring at the moment, and he was very quick. When did you first notice that you stopped hearing the air conditioner? Or the woman who was on stage yesterday? When did you first notice the depth of your centering and relaxation changed? I'll bet you didn't even notice that you couldn't hear the traffic anymore. All of a sudden, the burden of proof is being shifted, and the minimal cues that you noticed, I'll bet you didn't even notice that your muscle tone had changed, or that your respiration rate is different, or that your blood pressure has changed, or that your heart rate has changed. How about the heaviness in your legs and your hands and your feet? The sense is there. Well, they'll be dying to get off the hot seat. Yes, doctor, you're right. I'm in a trance. What do you think a trance is, anyways? Oh, I thought you just kind of go under and get knocked out. Well, no, a trance can be a state of focused attention. Have you noticed how your eyes look at me when I talk? You may be slightly more relaxed. You may be significantly more relaxed. And you know, Erickson said that a light trance was sufficient for almost any hypnotherapeutic work. So you move swiftly. You point out the evidence almost in the way a psychoanalyst would, working with people whose thoughts don't register it. Next. because I think I cured you the first time. However, I notice your pace is very pleasant. I like that. A story comes to mind. I think it's going to take you several weeks to digest this story. I had a patient, and picking up the minimal cues with my sensory perception, as he came into the waiting room, I could sense that he was dealing with homicidal, suicidal issues. But he's a nice man who likes to look good. So I immediately opened the waiting room door, charged out, put my hands around his throat, and started to choke him. And he broke out into hilarious laughter. Well, the following week, my mind was somewhere else. And I had opened the door because the man just didn't want to deal with his homicidal, suicidal stuff. And he came in, charged at me. I was seeing him 3 times a week, but he waited a week. Grabbed me by the throat unexpectedly, and I broke out laughing. Now, as he was a distinguished-looking gentleman of 62, he wore a jacket, tie, white shirt. He's a public relations man for a big firm. And as he was hanging up his jacket, I took the other wooden hanger from behind and put it around his throat, at which point we both broke out laughing. From there, I started to tell him stories about Peter Sellers. And Peter Sellers, in his movies, The Pink Panther, always had someone named Cato jumping out of the ceiling with surprise attacks. And he remembered that, and he kind of chuckled along. And then I said, but Peter Sellers' greatest movie was Being There. Now, I said the problem was, Peter Sellers said, when that movie was complete, his life's work was finished, and he died shortly after. So your own unconscious minds have all the material you need to begin to use the storytelling. I remember when I first saw Erickson, well, he was an awesome figure. And there was a bright young man I was seeing 1 time a week. And I told him about Erickson, and he said, well, something's missing. I said, what's that? You're not doing it. I don't know how to do it. I trust you. Take a chance. So I told my first set of stories. I never knew I could tell any. Instead of having a one-liner, I went to 5 minutes. I felt very proud of myself. The next hour, I stretched it to 7 minutes. And then the next hour, I told 10 minutes of stories. Well, pretty soon I was doing this 25 hours a week. My unconscious to the unconscious of the patient. That's like 25 hours of analysis a week. So, start slow. Start with one story. It could be anywhere in your past. A Peter Sellers movie. I never thought of that before, but it fit between myself and that man's particular difficulty. Brought him deeply into the present. Well, I think, yes.
I have some questions, Len, about the actual procedure that you do with patients. You know, we're professionals and we tell stories about professionals working with other patients. Do you, with your patients, tell about your work with other patients, or, you know, how do you select the story? They're conscious, but do you access then your work with other patients?
I might do that. It's pretty well disguised.
Because I had a therapist who told me at length about his work with other patients, and I never trusted him, because I thought he would then pirate my material and use it somewhere else.
Well, I've never had that problem. People usually experience me as someone with great integrity.
So if you were to...
But I would suggest that if you tell stories that it sounds like it's a hot issue for you, I would not tell them about other patients.
On principle, I would not.
Yes, I think that's a good point. I would recommend you read Erickson's Uncommon Therapy, it's called Uncommon Therapy, the Psychiatric Techniques of Milton H. Erickson, MD, Norton Press, paperback. Many great stories in there. There's another one, My Voice Will Go With You, The Teaching Tales of Milton H. Erickson, MD, Sidney Rosen. My book also has a chapter that deals with the storytelling. Well, I think it's about that time, and we have 4 minutes before Dr. Johnston begins, but I would like to introduce Dr. Johnston, particularly, oh yes, fine.